She was just getting her hair washed. That's all. A perfectly normal afternoon at the salon. Smell of shampoo, soft music in the background, her favorite hairdresser chatting away. Nothing seemed out of the ordinary. But the moment she leaned her head back into that porcelain sink, something shifted. A few minutes later, she was on the floor, unconscious. The ambulance came fast. The diagnosis came even faster. A type of stroke caused by something as simple as tilting her head backward. Doctors called it beauty parlor stroke syndrome. It sounds dramatic, but it's real. And if you're over 60, you may be more at risk than you realize. Now maybe you're thinking, that's just one case, a fluke. But here's the thing. There are dozens of similar stories. Many right here in the comments section of our own channel. People who leaned back to clean a ceiling fan, who tilted their head during a stretch, who tried to look up at the stars and ended up feeling dizzy, nauseous, or worse. And yet, most people have never heard of this. Not from their doctor, not from their physical therapist, not even after neck surgery or spinal fusion. Which begs the question, how can something so ordinary, something we do every day, hold such hidden risk? If you're watching this, there's a good chance you've felt stiffness in your neck. Or maybe you've avoided looking up because it just doesn't feel right anymore. Or maybe you've heard someone say, "Don't tilt your head back. You might have a stroke." Is that true? Is it fear-mongering? Or is there real science behind it? Today, we're going to lay it all out. Not just the risks, but the reality. The people it affects. The symptoms you should never ignore. And most importantly, we'll show you how to protect yourself while keeping your neck flexible and your life independent. Because instead of avoiding movement out of fear, what if you could stretch safely, confidently, knowing exactly where the danger lies and how to stay clear of it? Let's begin. So, let's ask the question head-on. Can simply looking up really cause a stroke? It seems hard to believe. After all, we look up all the time. Watching fireworks, hanging a picture frame, stretching after a nap. So how could that be dangerous? But here's what makes this question worth answering. It's not about the movement itself. It's about who's doing it and how. For some people, tilting the head back is nothing at all. For others, especially those over 60, it might trigger something deeper, something hidden beneath the surface. So instead of guessing or avoiding movement altogether, wouldn't it be better to know the truth? Wouldn't it be better to understand when it's safe and when it's not? Because if you've ever felt dizzy, unsteady, or unsure when moving your neck, this isn't just theory. It's personal. And today, you'll find out exactly why. Let's start with what really matters. Your body's warning signs. Have you ever looked up and felt dizzy? Maybe a wave of nausea hit you out of nowhere. Or your vision blurred for just a moment, and you weren't sure why. Some people say it feels like the room tilts. Others describe a strange pressure in the back of the head. And, for a few, it's like the world goes quiet for a second, as if something just isn't right. If you've felt anything like that, don't ignore it. These are not random. They could be subtle signs of what's known as vertebrobasilar insufficiency, or VBI for short. Now don't worry, we're not throwing around medical terms to scare you. Let's break it down. Inside your neck, you've got arteries, like tiny highways, that send blood and oxygen to your brain. Two of these run up the back of your neck through your spine. When you tilt your head back too far, especially if those arteries are already narrowed from age, plaque, or past injury, that blood flow can be temporarily reduced. It's kind of like a garden hose. Bend it too far, and the water slows down, or stops. That's when symptoms kick in. Dizziness, double vision, slurred speech, trouble swallowing, sudden loss of balance. And while these symptoms often fade quickly, the risk behind them is real. If ignored, that same drop in blood flow can lead to something far worse: a stroke. Here's what's important. Not everyone is at risk, but those with certain conditions, like high blood pressure, diabetes, a history of stroke, or past neck trauma, need to be extra careful. So instead of brushing it off or thinking, "Oh, I'm just getting older," ask yourself, is my body trying to tell me something? Because when it comes to your health, small signs are often the first signs. And listening now could save you a world of trouble later. Now, here's the part that surprises most people. Why haven't you heard more about this? Why didn't your doctor mention it after your last checkup? Or after that neck surgery you had years ago? You're not alone in wondering. One woman shared in our comments, "I had ACDF neck surgery in 2020. Not once did my surgeon warn me about this. I found out here, on YouTube." The truth is, this isn't a common topic in most doctor visits. It's not because they don't care. It's because medical appointments are short, focused on prescriptions, procedures, and pressing symptoms. Unless you specifically mention dizziness when looking up, or unless your doctor is highly specialized in neck vascular issues, this simply might not come up. And for many therapists, the focus is often on muscles, joints, and pain relief. Circulation problems? That's considered someone else's department. But here's the thing. Neck movement, blood flow, and age, they're all connected. And if nobody's drawing that line for you, you could be left in the dark about a real risk that affects your daily life. Think about it. You're told to stay active. You're told to stretch. But no one tells you that for some people, certain movements, especially extreme neck positions, might do more harm than good. That's why we're doing this. Because instead of fearing every movement, you deserve to know which ones are safe and which ones aren't. That's how confidence is built. That's how independence stays intact. You don't need more fear. You need better information. And that's exactly what's coming next. Let's cut through the confusion with something we can all agree on: evidence. There's no shortage of stories out there. Someone gets their hair washed and ends up in the hospital. Another tweaks their neck at yoga and ends up dizzy for days. It's enough to make anyone nervous. But what does science actually say? A major study, funded by the National Institutes of Health, looked at over 1.1 million seniors, all aged 66 and older. Some had neck pain and visited chiropractors. Some went to their regular doctors. Guess what they found? There was no significant increase in stroke risk for the chiropractic group. None. In fact, the rate of stroke was just as low as those who never had any spinal adjustments at all. So what does that tell us? It tells us that gentle neck movement, even when guided by professionals, isn't inherently dangerous. It's not the movement, it's the individual, the medical history, the vascular health, and how the movement is done. Other research looked into arterial dissection, a rare tear in the artery wall that can lead to a stroke. While that sounds scary, the data shows it happens in only 1 to 3 people per 100,000 each year. That's less than the odds of getting hit by lightning. Even then, Most of those cases involved forceful or rapid neck motion, like car accidents or contact sports, not slow, guided stretches. Then there's something called bow hunter's syndrome, a rare condition where turning or extending the neck pinches an artery enough to cause symptoms. This isn't common. It usually shows up only in people with very specific structural issues, like bone spurs or instability in the upper cervical spine. Now, here's where the science lines up with common sense. If you're over 60, if you have a history of high blood pressure, stroke, or neck surgery, yes, you should be cautious. But cautious doesn't mean fearful. Instead of avoiding every stretch, you can learn which ones are safe, how to do them, and when to stop. Because when you have good information, you don't need to guess. You don't need to be afraid. You can move smarter. You can move safer. And that means staying active, independent, and confident on your terms. So now you might be wondering, what about me? Am I one of the people who shouldn't be doing these stretches? It's a good question, and asking it puts you ahead of the curve. Because while most folks over 60 can stretch their neck safely, there's a small group that really needs to pause before they proceed. Let's go through who that is. If you've ever been diagnosed with vertebrobasilar insufficiency, a history of stroke or mini-stroke, severe carotid artery disease, major neck trauma, like whiplash, or if you've had cervical spine surgery, especially fusions like ACDF, then you need to be especially cautious. Also, if you've had episodes of unexplained dizziness when looking up nausea triggered by neck movement, difficulty swallowing without any clear cause, sudden blurry or double vision, or a sense of imbalance that only shows up when your neck extends back, these could be signs your body's warning you. One viewer shared that after a fall down the stairs, she had whiplash that led to a dissection of her vertebral artery. She didn't realize it right away. It was only after a new kind of migraine and temporary vision loss that doctors found the problem. Here's the thing. This doesn't mean you can never move your neck again. It means you need to get checked first. Get clear guidance from someone who understands the vascular side of neck health, not just muscles and joints. And there's one test in particular that therapists use called the VAT test, short for vertebral artery test. It's a gentle movement done under close supervision, designed to detect early warning signs. But here's the key. This is not something to try on your own. Because sometimes what feels fine at first isn't fine once held for a few seconds longer. So instead of risking it, get assessed. Know your body. And then move forward with confidence. Because your health isn't just about what you do, it's about knowing when to say no and when to ask for help. Now, let's talk about what you can do. Because if you're not in that high-risk group, or if you've been cleared by your doctor, neck movement can be one of the most powerful tools to stay mobile, independent, and pain-free. But here's the trick. It has to be done right. That starts with one simple tool: a towel. You don't need fancy equipment. Just grab a bath towel, fold it lengthwise, then roll it up like a soft rope. This towel is going to be your support, your safety net, and your guide. Sit in a firm chair with a back. Drape the towel behind your neck, holding one end in each hand. Relax your shoulders. Now, gently lean back into the towel and slowly look up. Just a little at first. Feel how the towel cradles your neck? That support takes pressure off the joints and muscles. Instead of forcing your head back with no control, the towel guides it gently, like a seat belt for your cervical spine. Hold that stretch for just 10 to 15 seconds. Breathe normally. Then slowly return to a neutral position. If that felt okay, you can repeat it 2 or 3 times a day. But remember, never push through pain, dizziness, or discomfort. Now let's talk rotation. To improve side-to-side movement, use your hand to gently assist the turn. Take your left hand and gently pull the towel across your jaw while rotating your head to the left. You're not yanking, you're guiding. It should feel like a stretch, not a strain. Then switch hands and do the other side. And here's a tip. You can adjust the towel higher or lower on your neck, depending on where you feel tight. The upper neck often tightens with age, especially if you've spent years looking down at books or screens. This stretch helps restore balance. So looking up to clean a ceiling light or check the sky doesn't feel like a chore. Because instead of letting stiffness build over time, you're gently training your neck to stay strong, mobile, and safe. This isn't about pushing hard. It's about showing your body it can move, without fear. Done right, these stretches feel good. And more importantly, they keep you doing the things you love, without the nagging pain or the scary uncertainty. So why do these stretches matter so much? Well, imagine this. Instead of struggling to look over your shoulder while backing out of a driveway, you turn smoothly, confidently. No stiffness, no hesitation. Instead of asking someone to help change a light bulb or check the smoke detector, you reach up, tilt your head, and do it yourself, without fear. Instead of dreading that pinch in your neck every time you wake up, you start your morning with ease and a little movement that keeps pain away. That's the power of doing it right. These aren't just stretches. They're a form of independence. They're a way of telling your body, I've still got this. And here's the truth. When done safely, these movements can improve blood flow, reduce tension and stiffness, support better posture, and help prevent falls, especially in situations where awareness of your surroundings matters most. Because let's face it, life doesn't stop requiring us to move. What changes is how we prepare for it. Rather than stiffening up over time, rather than living smaller because of fear, you can move smarter, stretch safer, and feel better every single day. It's not about age, it's about approach. And when you've got the right one, your neck doesn't limit your life. It supports it. Before we wrap up, let's take one more moment to talk about safety. Because even though these stretches are gentle, even though the risks are rare, your body still deserves respect. So here's the bottom line. If you ever feel dizzy, lightheaded, nauseous, or unsteady when doing these movements, stop immediately. Don't try to push through it. Don't brush it off. Your body whispers before it screams, and those whispers are worth listening to. Also, if you've had neck surgery, strokes, or vascular conditions, get cleared by your doctor first. It takes just one appointment to know if these movements are right for you. One conversation that could prevent a big problem later. Because stretching should feel good. It should bring relief, not fear. So rather than guessing, hoping, or doing what your neighbor does, take the time to understand what's right for you. That's not caution. That's wisdom. And wisdom keeps you moving forward. With confidence, clarity, and control. So what's next? You've learned the risks. You've seen the science. You've heard real stories from people just like you. And now, you know how to move safely, stretch with purpose, and protect your health without giving up your freedom. But this is just the beginning. Because your neck isn't the only part of your body that tightens up with age. Your shoulders, your hips, your lower back. They all matter. And the way you move today determines how you feel tomorrow. So if you found this video helpful, we've got something even better lined up. Click the next video on your screen. It's all about 3 essential daily stretches every senior should do. They're simple, they're safe, and they're specifically designed for people in their 60s, 70s, and beyond. Because instead of living smaller with each passing year, you can live smarter, you can stretch smarter, and you can feel stronger, longer. And if you haven't subscribed yet, go ahead and hit that button. Not because it helps us, but because it helps you stay connected to tools, tips, and strategies that actually make life better. Because your health is worth the time. And your independence? That's worth everything. See you in the next one.